Hello, everybody. I am so happy to be here and really so honored to be here. I think they'll have to tell me, this is either maybe the fourth time that I'm coming to speak to all of you, and several times live. And now it's several times virtual, which is the crazy thing about this awful pandemic. And I so wish that we were all in person together, because every time I speak to this group, it is more and more electric and incredible. And so thank you for all of you, all of that you do. Thank you for being here. Thank you to Zero for having me and for making sexual health just a conversation about health like anything else. I am Dr. Rachel Rubin. Please follow me on social media. I'm getting louder on both Facebook, Instagram, and Twitter at Dr. Rachel Rubin. My background, I'm a urologist, but my fellowship training is in sexual medicine for everybody. I take care of all genders, and sexual health is just health. And as all of you, anyone with prostate cancer knows, everything about prostate cancer can affect your sexual health. All the treatments, all the solutions, every aspect of prostate cancer. And not all my colleagues are so good at talking about or asking about sexual health. So I'm here today to just give you a hug and say, these are health conditions that we should be able to talk about just like any other condition, and to give you the tools available to seek help and good medical care for your sexual health concerns. So thank you. And I really just want to start with biology. I truly believe if you understand what's happening in your own body, well, then we can come up with solutions of how we can make it better or how we can improve your quality of life. And too often, the only time we get to talk about sex is with this guy. I actually remember my middle school gym teacher who taught the sex ed class in my school, which is just wild. That was the only time I got a sex talk. And I actually don't remember anything about it. I only remember the word smegma, which is kind of funny. And that's it. When else does it happen? When do we get an update? When do we have an adult class of this is what sex ed should look like when you have prostate cancer or breast cancer or, break a hip or something? Nobody gives you that class. Instead, we like to talk about private parts, and we like to make it seem like genitals are not something that is appropriate or okay to talk about, even with your spouse or even with the doctor who is the one responsible for your private parts and potentially operating on your private parts. And so we have to keep a little bit lighthearted and joke about this, because if you can't have a sense of humor and you can't make sex fun and enjoyable, then you're not doing it the right way. And so we have to also laugh and be able to talk about this lightheartedly and also very seriously and just be comfortable. And so I'm trying to get you all excited to kind of hear about these issues and feel more comfortable. Now, I'm uniquely positioned because I take care of all genders. And certainly we are just as bad, if not worse, in treating women's sexual health as we are men's sexual health. At least with men's sexual health, we all know about Viagra and blood flow and testosterone. In women's sexual health, we're way worse. And we often examine women and their genitalia like we're mechanics, right? We hide under a hood, a sheet, so nobody can see the private parts. And we just make it worse and worse. And so at no point are we really talking about comprehensive sexual education. And how do we should be doing this for teenagers, but gosh, all you 70 and 80-year-olds listening, we need to do it for you too. Talk about how mental health affects sexual health and gender and body image, safety, communication. How do you tell your partner, honey, that move you've been doing for 30 years, it's not working anymore. And I wish it was working still. Maybe we have to find some new moves, or maybe we need to bring some new ideas into the bedroom. How do you have those conversations? It's really challenging, and nobody ever trained the doctors to have those conversations. We must look at sexual health as what we like to call biopsychosocial, right? Biology is so important here. If you have your prostate removed, you're going to have biological reasons for sexual problems. If you have breast cancer, you will have biological reasons to have sexual problems. If you are menopausal, you will have biological reasons to have sexual problems. But we can't discount the psychosocial, your upbringing, your performance anxiety, your mental health, your societal expectations. All of that goes into your sexual health, which makes it so deliciously complicated, which makes me love doing this for a living, because it's so challenging. And I am always interested because I'm always learning from my patients and from my colleagues. And really, it's just the best field in the world. And I'm so grateful. But I don't know about you. How are you going to do all of this in a 10-minute doctor visit? Medicine is incredibly broken. Your 10-minute visit where you're going to have a doctor explain how your PSA looks and explain about radiation and talk to you about surgery and talk to you about complications of surgery. I don't know if your head's spinning, but my head's spinning in that 10-minute doctor visit. And so I wish I could change the system, because every conversation with a doctor deserves time for them to really get to know you, to know what your core values are, to know what you care about, to know what you want out of life, and then to help design a treatment strategy and a recovery strategy that fits within your mission and your goals. And so I have decided to not play that game. I take an hour with people. I spend a lot of time really getting to know my patients, but it is an incredible challenge. And the current insurance-based model is just we can't do it very well. And so I sadly will not be able to fix it. But when I treat people for sexual problems, there's a lot of overlapping conditions, and this affects all genders. I see people who have pain, people have libido or desire issues, arousal or erection problems, and orgasm problems as well. And I like to think of myself as Dr. Rachel Rubin, sex detective, right? Because it's a puzzle. It's a puzzle to try to figure out what's going on with people, and people are challenging and complicated, and their medical histories are challenging. And so not only is it a puzzle, but a urologist like myself cannot fix all of the problems. I have to often work with specialists of all kinds, whether it's cancer doctors or radiation oncologists or pelvic floor physical therapists or mental health professionals. I have to work within a team. And I really want all of you survivors out there to really listen to this and say, it is not going to be one doctor who fixes all the problems. I wish we were that good. We are not that good. It is gonna be a team of people, a team behind you to get you that maximal benefit and maximal quality of life benefit. And so I'm going to give you some tools of how to find some of those providers, because not everywhere. I know you're all coming from different areas. Let's start with the urologist. Not all urologists are equipped and trained to really dive deeply into sexual problems. And so the Sexual Medicine Society of North America, or SMSNA, and you can find it on the internet, smsna.org, has a find a provider directory. And so you can type in where you live. And if you happen to type in Washington, D.C. or Maryland, you'll find me, hopefully. You will find providers in your area who are urologists, who are trained in sexual medicine. This is what we do. We love helping people with sexual health problems. And if you can't find one, send me an email and I'll find someone as nearby if we can. Now, we know pelvic floor physical therapy is so important in prostate health, and we'll talk about that. But if you have leakage, if you have pelvic pain, any kind of pelvic issues can sometimes be a musculoskeletal problem. The pelvis is just a bunch of muscles, and we can, just like we can train our biceps, we can train our pelvic floor muscles to work better. Sometimes they're too tight and need to be relaxed. Sometimes they're too relaxed and need to be strengthened. And so pelvic floor physical therapists are my ultimate team members in this world. And so pelvicguru.com is one of many websites that you can use to search in your area. And in that middle, you see men's health, and right next to it, sexual health. So you can find someone who's focused on the things that you care about and the things that matter. Mental health is so important. Oh my goodness. I tell you, if a pandemic hasn't taught us anything, it's to understand that mental health affects all of us, and it can happen very quickly, and how important it is to take care of our mental health. And so for anyone with a partner or who has any type of cancer, or really anyone living in the world in 2022 needs a mental health provider. I don't know who doesn't need one. And there are many ways to find a mental health provider. If you don't want a specific sex therapist, but just someone to talk about cancer or anxiety or depression, psychologytoday.com is a wonderful website website where you put in your zip code and you can say, I want a sex therapist, or I want an anxiety therapist, or someone to talk about cancer with, and it will give you all profiles. It's like almost like online dating. You can see the face and the profile of someone and find a good fit, because anyone who needs a therapist knows that if they don't understand where you're coming from, or you don't feel like you can talk to them, it's not the good fit. So you have to find someone who seems like a good fit. And sometimes they're very busy, especially in pandemic times. So you got to try a few out before you find the right person for you. Now, there are special sex therapists out there, and AASECT, or ASECT, is the American Association of Sexuality Education Counselors and Therapists. That is specific if you want a certified sex therapist. And these are just the most brilliant people on earth. You can put in your zip code and find someone who does sex therapy. What I do in my practice as a urologist and sexual medicine specialist is I really focus on the biology piece, is what is happening in your biology, in your body, that is affecting your sexual health. And I can't do this in 10 minutes because I have to understand what is happening in your brain, what is happening in your spinal cord, which innervates and makes us feel all of the things that we feel, and what is happening in your pelvis. All sorts of things can be affected here, right? You have to really listen and take time to understand people to really know how your plumbing is working or is not working. So if you've had your, let's take, for example, if you've had your prostate removed or radiated, right? And it's this tissue here, how is that going to affect how your penis functions, or how you evacuate stool, or how you urinate, right? And so understanding the anatomy and how it is working or not working is really, really important. And in order to have an orgasm, you need to have healthy nerves, shooting up from your penis to your brain and back down again. And so orgasm is just a reflex. It's a very pleasurable reflex, but it's just a reflex. And so how can we activate that reflex if it's not working the right way? And so we spend a lot of time talking about anatomy and really trying to understand the way your anatomy works, right? The penis is just a muscle. Muscles do two things. They contract and they relax. And it is actually when the penis relaxes, and you can see this spongy-like tissue here in the middle of the penis. Hopefully you can see my, let's see if we can see it here. So the spongy area in the penis right here, right in the middle. Maybe you can see it, maybe you can't. So yes, there you see it. So that spongy-like tissue, when that relaxes, blood can flow through it and the penis gets bigger and harder. But in order to have functioning spongy tissue, you need healthy tissue. So testosterone is important for healthy muscles. And if you have metastatic prostate cancer, that affects your muscles. As you age, your muscles are not as strong as they could be. And you also need healthy nerves to tell the muscles to relax. You also need healthy arteries and healthy blood flow. And so all these things, all types of, right, if you have high cholesterol or a high blood pressure, that may affect the arteries to your blood flow. If you've had prostate surgery, it may affect the nerves. If you've had low testosterone, it may affect the muscles. And so these are really complicated issues that can affect how well your penis does or does not get erect. And so understanding that is very powerful for you to understanding what the treatment options are. And very interestingly, oh, we don't need that line anymore. Very interestingly, all the genitals are the same. So I am very uniquely qualified to take care of all genitals. And so vulvas and penises are exactly the same thing. And so if you have problems with erections, it's possible that if you have a female partner, that she may have problems with penetration or pain or dryness or urinary tract infections due to a medical problem. And so that's why I love working with couples and working with two sides of the coin, because we can get all the erections in the world, but if there's no place for them to go or no partner, are we making everybody happy? And so we always have to kind of figure out what do people really want. So anyone who's heard me talk, I tried to change the talk a little bit this year, because you can look on YouTube and see my prior talks. And we often talk about erectile function, and we don't spend that much time talking about libido, arousal, and orgasm. So I tried to mix it up a little bit this year. But really, libido is something we don't often talk about, the desire for sex, the interest, the wanting to want. And libido issues affect all of my patients of all genders. And we have to get a little bit more comfortable talking about that. And I do think this hip picture is really helpful because it shows how complicated this issue is. And right, so if you look in the middle circles, you see desire and you see arousal, which is think erections for arousal. And so many different pieces go into improving or making this worse. So if you look here, let's see if this works. Yep, perfect. So if you look, here is desire and here is arousal. And if you look at something like dopamine, dopamine improves this stuff, right? You're on a sexy vacation, boom, you get a hit of dopamine and you now have interest. You are watching a sexy movie, perhaps, boom, you get a hit of dopamine and now you're super excited. You're watching pornography. Ooh, you see something that really interests you. Boom, you get a hit of dopamine and your brain goes wild. That's biology, right? Dopamine is biology. How about you see a tiger trying to chase you? That's adrenaline, which contracts your muscles, which gives you fear and anxiety. That's going to be negative to desire and arousal. Testosterone can boost dopamine. Certain medications that affect serotonin can hurt dopamine. And so all of these things can affect your desire and arousal. It's biological. Now, of course, there's many things in your psychological or a cultural history that can affect your desire and arousal as well. Just like if you're running from a tiger, you don't want to have an erection. Not everything presents as a tiger. So if you have anxiety and PTSD, that is like having a tiger around all the time. That may affect your ability to be interested or get good erections. And so arousal and orgasm, erectile function and orgasm, those are all really important issues too for all of my patients. And so we're going to talk about that just a little bit. Right, the penis is just muscle, but it's innervated by nerves, and the nerves come from your back. And so depending on how healthy your back is and how healthy your nerves are, if you have diabetes, for example, that can affect your nerves, which can affect your orgasm. If you've had 12 back surgeries, it is possible that your orgasm may be absent or delayed. And so understanding that biology can affect sexual function is really, really important. And I don't know about you all, but I certainly know that there's a big pay gap in our country, that women are paid much less than male counterparts for the same work. And it is seen over and over again in so many different fields, but definitely in medicine and certainly in urology. I am paid a lot less than your perhaps your robotic surgeon who removed your prostate. And I would argue that I do a lot of great things as well. But it's not just a pay gap that we have in this country. We actually have an orgasm gap in this country. For every orgasm, this is a very interesting data set where they looked at orgasm frequency among gay, lesbian, bisexual, and heterosexual men and women in a US national population. Okay. So if you look at a heterosexual woman, it says reports of own orgasm frequency. A heterosexual woman reports a 65% orgasm frequency, always or usually. Okay. A heterosexual man reports always or usually 95% of the time. So you've got 95% of the time versus 65% of the time. That is an orgasm gap. It gets a little bit better when you look at women who have sex with women, as well as bisexual women, gay men, and bisexual men. And so why do we have an orgasm gap in this country? Because of expectations, right? Because of our sex education and our knowledge about orgasm and who deserves the pleasure and what is sex. And so if we gave every man in the world a stopwatch and who was having heterosexual sex, and when he orgasmed, he stopped the stopwatch, how much time do you think goes by on average? Think to yourselves, how much time do you think goes by on average? 2 minutes, 20 minutes? Man, I watch pornography, 2 hours. That's crazy, right? What is average? 5.5 minutes is average, right? If you give every man a stopwatch in the world, 5.5 minutes, that means half less than 5.5 minutes and half more than 5.5 minutes, but 5.5 minutes is that average. What happens if you do the same study and you give it to women? Well, the average is about 13.5 minutes, 17% of the people asked had never experienced an orgasm, and penovaginal intercourse was insufficient to reach orgasm in the majority of people who took this survey. And if you look at all the countries here, you've got the US is 13 minutes, okay? So if you live in the Czech Republic, it's only 6.8 minutes. So they have much quicker orgasms, which is great. In Hungary, they have 22 minutes. So big difference there. So why is that? Biology. It's all because of biology. So the clitoris and the penis are the exact same thing. They're made up of the same tissue, the same muscle tissue. And if you look under the microscope, they look exactly the same. But guys, if you rub the inside of your thigh, are you going to have an orgasm? Inside of your thigh, rub it 5.5 minutes. No, you're not going to have an orgasm. It's close to your penis, but it's not quite your penis, right? You need that shaft stimulation. So inside of the thigh is not going to give you an orgasm. Similarly, the vagina is close to the clitoris, but it is not the clitoris. The clitoris lives mostly under the vulva skin. You see a little bit of the nub in here. There is a hood that goes over it. This is the only part. So the head of the clitoris is exactly the same as that very tip of the head of the penis. There is a whole shaft of the clitoris and long legs of the clitoris, just like there are long legs of the penis that go all the way down to your butt bones. So if you rub the clitoris or you put a vibrator over the labia, that can typically activate a female orgasm. Whereas the vagina, which is down here, no matter how much you rub the inside of your thigh, you're not going to have an orgasm either. And so very few women, we think it's 10% or some magical number of women can orgasm from vaginal stimulation. And it may be that they have very sensitive clitorises that can activate from a very close proximity. And so this is why vibrators are so valuable in a couple. And vibrators work for penises as well. They don't just work for clitorises. And so I believe the couple who brings in devices, and this is a website called Promescent, which has products for delay sprays for premature ejaculation. They sell lubricants and they sell devices that really can be good for couples in general. And so if you go to their devices, you can look and they have all sorts of fun devices that can be helpful in the bedroom to just add some fun into the bedroom, because who doesn't have technology improve their life these days? Gosh, I can order groceries on my cell phone. It's amazing. And so technology can really, really help you make sex more fun. And sex is about fun and pleasure and enjoyment and quality of life. And so if you can add tools to your toolbox, who wouldn't want to do that? And so we've talked about libido, we talked about arousal and orgasm, but what about pain? Pain is a really common thing that we see. Sex should not be painful. Vagina should not hurt, vulva should not hurt, penises should not hurt. It should not be painful. And so I helped with a couple chapters in this book called Facing Pelvic Pain. My good friend, Dr. Day, helped to put together a really lovely book on so many different reasons that people have pelvic pain. And so sometimes it's muscle issues, sometimes it's nerve issues, sometimes it's hormone issues. And so it's really important to understand that biology plays a really strong role here. And something that I treat very commonly, so many of our prostate cancer survivors are in their 50s, 60s, 70s, 80s, and they have female partners often who are also in their 50s, 60s, 70s, and 80s. And the female body parts are very hormonally sensitive, just like the male body parts. And without hormones, the vaginal canal gets dry and irritated and can bleed. And women often get a decrease in their arousal, orgasm, and desire. But it's not just about sex. Women often get, even if you're not sexually active with your partner or not having penetration with your partner, if she's having irritation, burning, or itching, if she's having pain with, if she's having urinary tract infections or urinary frequency and urgency, it is very often due to a lack of hormones to the tissue, or something that we call genitourinary syndrome of menopause, or GSM. And it is incredibly easy to treat, safe to treat. And I talk a lot about this on Twitter and on social media, because while it is a simple point, it's very important to do. And like wearing your seatbelt or brushing your teeth, it's a therapy that you need to do forever, right? You never get to say, oh, I've brushed my teeth for 20 20 years, I'm done. I did my due diligence, or I've worn my seatbelt for 40 years. I'm good now. I don't have to wear it anymore. Of course, we have to keep doing that. And so vaginal estrogen, local vaginal estrogen is safe. We use it even in breast cancer patients sometimes. It is safe for almost all women, and I would argue all women actually. And it is just a local therapy. There's a number of different ways to do it, but it doesn't matter if you're 98 or 58, and it is doing something often just twice a week forever. And now with some new pharmacies out there, we can do it for as little as $10 a month, which is very exciting. It doesn't have to be expensive. It's really, really important to do. So if you have a partner who's having issues, it may not just be the hardness of your penis. It may be that your partner is having biological issues as well. So I know that was a lot of information. I know that we didn't really go into all of the treatment options for erectile dysfunction or for urinary leakage. Those are, of course, things that happen in prostate cancer and that my prior lectures go into in full depth. If you do want to hear more, please, Zero has my prior lectures. We have a great podcast that I did with Zero that talked about sex after a diagnosis of prostate cancer. If you follow me on social media, I have lots of podcasts and ways to put more content out there, and always happy to do more. So you can always sign up for the website, rachelrubinmd.com, and lots of content will be sent out. And really, I just want you all to know that sexual health is just health, that your quality of life really, really matters, and that there is so much that we can do to help you. You just have to sometimes find the right providers and really advocate for yourselves and really say, this matters. You may not be the right provider for me for this particular subject. So how can we find someone who will spend the time to listen and to work with me to find the best quality of life solution? So thank you so much for supporting Zero and all the amazing work that they do. Let's keep fighting together. And if you have any questions, please don't hesitate to reach out. And thank you again for having me. It is just my absolute honor.